So, welcome to the podcast where we chat about fresh ideas and leadership in healthcare. Today, I'm excited to have Dr. Mary O'Connor with us. Mary is an orthopedic surgeon and co-founder and chief medical officer of Vori Health and a recognized high achiever. She even authored a women's health book, Taking Care of You, and the healthcare system also often has an issue with unnecessary procedures, and Mary is doing amazing work to change how we think about musculoskeletal care, making it more holistic and accessible. Mary, it's great to have you here.
Thank you, John. Delighted to be with you and your audience.
So your journey has been truly remarkable. Your background is an Olympic athlete, I hear?
Yes. Women's rowing.
Yep. And the book that you wrote, and now you're co-founded Vori Health. Each step, I'm sure, takes an incredible amount of passion to achieve. Could you share a little bit about your story first and how these experiences have shaped the path that you were on and where you are today?
Well, since I'm not sure when you'll be broadcasting this, but since our men's and women's hockey team just won the gold medal in the Winter Olympics, kudos, so proud. Go USA. I'll start with sports and how important sports was for me personally, and how important I think it is for our young people, and particularly for young women, and why that matters for business success and leadership development. So I'm a product of Title IX. There were no sports for girls in my high school when I was growing up. And when I went to college, I went to Yale. I actually participated in an infamous protest. We didn't have a boathouse we didn't have a locker room at the boathouse. And we went in, 19 of us, one day to the athletic director's office and stripped and had Title IX written on our bare chests and backs to say, these are the bodies that Yale is exploiting and we need a locker room. Which had been in conversations, but there was always some excuse as to why can't the women have a locker room yet? Anyway, we had a reporter from the Yale Daily News and a photographer there who took this iconic picture of our captain with her back, Title IX written across her back, and the assistant athletic director standing in front of her kind of with this very close body language that you can imagine, right? Not what she expected going into work that day. And the story was picked up from the Yale Daily News by the New York Times and the International Herald Tribune, and basically the university was embarrassed into action, and lo and behold, the seas parted, and we had an addition to the boathouse the following spring with the locker room. So ours was heralded as the first stand for Title IX in college athletics. And it was that athletic experience and being on the national team and the Olympic team that honestly I've always felt it gave me an in to enter orthopedic surgery, which is still male dominated, but was dramatically male dominated when I started my training program.
Yeah.
And I never thought of that as some kind of sexist perspective. And, I always thought that here are these men, these orthopedic surgeons who are looking at me as a candidate, as an applicant, and they're saying, wow, that's really cool. Like she accomplished something that they could understand, demonstrated that I had determination and resilience and self-discipline.
Yeah.
And, could take the licks and get up and keep going, work through injuries. And I think that really helped me get into, an amazing orthopedic surgery program at Mayo Clinic in Rochester, Minnesota, and is something that I always looked for when I was interviewing for faculty positions or positions in my new company or residency applicants or fellowship applicants, which is show me that you had the ability to excel at something. And it really wasn't totally relevant what it was you excelled at, but if you got really good at something, it could have been dancing, baking, whatever it was. Yeah. That showed me that you already had these skills. And I wasn't going to have to try to teach you these skills, which you should already have if you're going to become an orthopedic surgeon or you're going to be on faculty or I want to hire you for my startup company. Yeah. So I think sports is so important, and you don't always win, but it's the it's striving for the excellence in each of us that I find so inspirational. And what I thought was so inspirational about the men's and women's hockey team and all the athletes that participate at that level. So anyway, sports is big. Sports is good. All kids should do sports. It's healthy for them, helps combat obesity, all those good things. Movement is the source of all health. And as an orthopedic surgeon, like if you don't move, it's very, very bad for your joints, very bad for your health. After my training, I went on staff at Mayo Clinic, Florida. I was the first woman orthopedic surgeon on staff in the Mayo Clinic system. Had a wonderful career at Mayo. I was chair of the orthopedic department there, lots of leadership roles in the institution and across the enterprise. And then I retired in 2015 when I was recruited to Yale to go create an integrated musculoskeletal center. And I worked on that for about 5.5 years and then left the comfort and security, John, of academia where I'd been my whole life to take the plunge into entrepreneurship. And that has been very rewarding. And the reason why I did it is because I realized that the fundamental changes that we need to make in the healthcare system are incredibly difficult, if not outright impossible, in the traditional healthcare system.
Yeah, wow. So what makes the virtual first musculoskeletal care company different from that traditional?
So that's a great question. So if we think of if I was the queen of the universe and I could just redesign healthcare, right? And say, what is the system that I want for me and my children and my husband, my family? I want easy, convenient access, which is just what we're doing. It's telemedicine. And I want to be able to seamlessly move from virtual care through telemedicine to in-person care when I need it and back. I want to be able to go back and forth. It shouldn't be one or the other. That's the ideal scenario. Secondly, I want to have the best non-surgical care that I can have to see if I can get better without an operation. So when we think about patients who get surgery, patients who go to see a surgeon, there's going to fall into 3 categories. One, this person absolutely needs an operation. They benefit from an operation. There's no question about that they're an appropriate candidate for surgery. And then there's the group that absolutely not. You don't need surgery, or the risks are too great, or we really don't think it would benefit you.
Yeah.
And then there's this big group in the middle, right, where you kind of go either way. And that's really where our telemedicine company comes in for that group and the group that's not people that aren't candidates for surgery, to say, let's really give you great non-surgical care first. And if you need to see a surgeon, then we're happy to get you to a surgeon. So we're not anti-surgery at Vori Health. That's the name of my company. We're just anti-inappropriate surgery. And we know that there's a lot of that happens. If you look at low back pain, people that have surgery to their low back, there's data that shows that 50% of those surgeries are inappropriate.
Yeah.
Up to a third of knee replacements, of which I've done thousands in my career. So there's a lot of opportunity for us to improve the way that we're giving care. And not only does that save money, but it also decreases risks to the patient, because there is no surgery that a surgeon can do that does not put a patient at some risk of a postoperative complication.
Yeah.
So, of course, it makes sense, right? Shouldn't we try to get you better without an operation first? The challenge is that the system isn't really structured to promote that. And patients will see their primary care doc, and then they get referred to a spine surgeon or an orthopedic surgeon. And surgeons nowadays do not have the best, I'm just going to be very frank, the best training in how a patient could be treated non-operatively without surgery. So our focus is we want to, again, give that great non-surgical care, and we want to do it in a more holistic way. 2 brief examples, because I could talk about this for hours. So in the traditional system, how often do we really focus on helping a person who has a musculoskeletal condition, let's take low back pain, improve their sleep? No doctor has time for this. Nobody does this. But we know that if we help those patients improve their sleep, and that's all that we did, we would improve their back pain.
Yeah.
Okay? We know that if we can help patients adopt better nutrition, meaning an anti-inflammatory diet, that's going to help their back pain. And how often does that happen? So we have musculoskeletal expert doctors, we have physical therapists, exercise physiologists, health coaches, registered dietitians who are the nutrition specialists. And so we bring all these people together to support the journey of that patient with the goal of see if we can help you get better without surgery. If not, okay, then we'll get you to the surgeon. But so many people can get better without surgery, and so many more people can get better than currently do in the present traditional system.
So with the work with the musculoskeletal care and your emphasis on fairness with healthcare, how do these two areas connect, the fairness?
So access is critical, and almost everybody has a smartphone. Even people of lower socioeconomic status, they have phones. So except for people that are in some geographic areas in the States in rural America, they may not have great internet access. And, Starlink is probably too expensive for them. But there is still a huge opportunity to bring better access to patients through telemedicine. And when you look at people in rural communities, they often lack access to specialists. And we are basically a specialty medical practice focused on musculoskeletal care. So we look at our opportunity to help improve access and to decrease healthcare disparities amongst those individuals that unfortunately experience them.
So the traditional healthcare system relies heavily on referrals. What does it mean to Vori Health to be beyond referrals, and how that helps patients with?
So our primary business model is that we built the care delivery system for value-based contracting, value-based payments. So in the kind of traditional world of medicine, the payment is called fee-for-service. You go to see the doctor, there's a bill that's sent to your insurance company, the bill gets paid. We said we want to have this holistic model. We want to be able to support our patients with health coaches, with nutrition specialists, which are almost never paid for in the traditional medical insurance world.
Yeah.
So because we know we want this holistic model, we are going to design the way that we do contracts with payers to be along the value-based payment model, which could mean what's called a population health contract. We're going to take care of a population of your members and get paid a certain amount, or we're going to be paid based on a bundle where the payer pays us a certain amount to provide care to you for a year. Basically, we don't do fee for service because it doesn't fit with our philosophy of how we want to deliver care to patients.
And you're working with insurance companies mainly?
So the two biggest groups that we work with are self-insured employers and insurance companies. And the self-insured employers, they get this, John, immediately, because musculoskeletal care is typically one of their highest spends.
Yeah.
And that depends on the kind of business that they have, right? So a company that has employees that do a lot of physical labor, their MSK costs are off the chart.
You're talking about workers' comp, right?
It doesn't have to be workers' comp. It's just that they get aches and pains because they do physically demanding jobs.
I see, yeah.
Insurance companies are also looking for solutions because you remember their product is purchased by an employer. Okay? And employers cannot sustain astronomical rises year to year in insurance premiums, which unfortunately, traditionally, what happens there? They get passed down to the employee with higher out-of-pocket expenses or high deductible healthcare plans. So there's all this out-of-pocket expense for individuals and families, and that makes healthcare inaccessible. So one of the things that we do in our contracting, and we're almost always successful, is to say no copays for patients who come to see us. So unlike traditional insurance where often patients have a copay to go see a physical therapist, we say no copays to come and get physical therapy with us, or to see our doctor or health coach or nutrition specialist or our exercise physiologist. So that's really important to support patients being able to engage in a care plan to get better.
So tackling the unnecessary procedures, how do you ensure the quality within the company?
That's a great question, John. And I'll start by saying there's a lot of good evidence. We call it, evidence-based medicine, evidence-based protocols that gives physicians guidance on when certain tests should be ordered or not ordered, for example. And so I'm going to backtrack for a second. So one of the key reasons why the traditional system is so broken is because of the payment model, which goes back to this fee-for-service versus value-based payment. But when you look at hospitals and healthcare systems, every single one of them in this country generates their financial margin on elective surgeries, advanced imaging, and procedures. And this is why hospitals were financially hemorrhaging, when they were full of super sick people during the COVID pandemic, right? They're busy. Well, you would think if the hospital's full and the hospital's busy, why is the hospital not doing okay financially? That's because it was full of the people where the reimbursements were not meeting the expenses. And so the whole system financially is built on elective surgeries with a big focus on orthopedics and spine, doing a lot of advanced imaging like MRIs and CTs and procedures. Yeah. So if you introduce a model like our model, it says, hey, you don't need an MRI right after the first visit. Let's get you started on physical therapy. Let's get you sleeping better, eating healthier. Let's do these things. Yeah. And you know what? If you're not improving, then maybe we do need to order the MRI, and we'll order it then. So again, using kind of evidence-based protocols to guide when we order advanced imaging. So what happens in the more traditional world is you see your primary care doctor, the primary care doctor orders the MRI shows something abnormal. Okay, well, John, you're a pretty young guy, so maybe for you, your MRI would be normal, but you could MRI any joint on me, and there would be some age-related change.
Yeah.
Now, just because I have that doesn't mean that that's the cause of my symptoms. And we know, particularly in the spine, that oftentimes those MRI findings do not correlate with why the patient's having pain. So you don't treat the MRI, you treat the patient. But the MRI will bias the patient and the surgeon to pursue surgical treatment. I have neck pain. I've got a bulging disc in my neck. Yeah. I say to my surgeon, well, can't you just go take out that bulging disc and won't that cure my neck pain? Mm-hmm. And the surgeon says, well, it may help.
Yeah.
Right? And we, as a society, we're kind of looking for the quick fix. But the problem is that surgery is not always a quick fix.
Yeah.
And, the rates of people going back to the operating room for additional surgeries, particularly after low back surgery, is not insignificant. So all of that to say, the primary healthcare system has to survive by promoting elective surgeries, advanced imaging, and procedures to generate their small profit margins. Hospitals exist on 2 to 4%, maybe 5 or 6%. These are not like double-digit margins that hospitals live on.
And yet it's so expensive.
And we all need a good hospital in our community. I view hospitals as essential services. It's like you have to have a fire department. You have to have a police department. You need a hospital too. So we want hospitals to be healthy and to be successful. But they're caught in the classic Clay Christensen's innovator's dilemma, where they can't innovate because it's going to affect their financial bottom line, and it keeps them from trying these new things. Hence the startup, and they will go outside the traditional system and work to bring change.
Yeah. So as a leader in a growing company, what is your biggest challenge you face in expanding Vori Health?
Well, there's always lots of challenges, John.
Sure, yeah.
For me, as in my role as chief medical officer, it's anticipating volume that's coming in with new contractings for clinical staffing, right? So I don't want to overhire and I don't want to underhire. So that's a balancing act. Bringing in new product innovation to create a more engaging experience for our patients. We've traditionally thought of healthcare as having to be an experience that you tolerate because you have to do it. And our philosophy is, why can't that experience be enjoyable? We get it. If you don't feel good, you don't feel good. But why can't your experience still be more positive? Right? Like we somehow just accepted that it has to kind of suck.
Yeah.
Well, why? We shouldn't have to do that. So we're very focused on the experience that our patients have with us, because if they have a good experience, they're going to be engaged, and then they're going to stick with their care plan, which increases the likelihood that they're going to improve, right? So it's all a win.
Yeah. I mean, just an example myself is I've worked at a nursing home. Some patients would say that it's like a jail. Like the walls were painted cinder blocks, and it just looks really like it's just not a friendly environment to be in. And then I just went to the pediatric dentist for my son, and I've never seen anything. There's like Legos everywhere and all this kid stuff, and my kids that went in there, they were having a blast and they enjoyed it. It just does make it more of a positive experience when you make those little changes.
Exactly. As a parent, you don't, if your child's having a negative experience at the pediatrician and you've got to take them there the next time, they don't want to go.
Yeah.
So that's, we think a lot about the experience of our patients and hiring clinicians that are very focused on how can I connect with you through a video, right? How can I make sure that you know that I actually care about you and I'm putting your welfare first. And in some ways, John, I actually think it's an easier connection. So when you go in the traditional healthcare setting, right, your doctor, your nurse, your clinician is sitting there with you, but what are they really looking at? The computer with your medical record.
Yeah.
And for us, I need to be looking at you. So
yeah, and it's hard to even fault the clinicians for it. They have a lot of work to do.
I'll tell you one other thing that in terms of kind of our focus is we ask patients what matters to them. We didn't create this concept, but we have adopted it. It was created by the Institute for Healthcare Innovation, I want to say, IHI. I might have the details wrong there, but it's what matters to you, not just what is the matter with you. So patients come to see us because they have back pain. That's what's the matter with them. But why does that matter to them? It matters to them because they want to play with their grandchildren, or they want to run a 5K, or whatever that is. So our care plan for that patient is focused on what matters to them. We want to get you back to doing what it is that you love, that gives you joy, that contributes to your quality of life. Now, that means we're going to have to help your back pain.
Yeah.
But it's not about the back pain, right? It's about what matters to you.
So I had a question. What's one project at Vori Health that you're really proud of right now?
Well, this is another thing that's really fun being in the startup world, is that it's so much easier to innovate in this environment than in any of my prior academic positions. Not that I did a lot of innovation when I was at Mayo Clinic, but I can do it faster and easier and take more risks in the startup. I don't have to go through 10 committees and, all this layer of bureaucratic change and permission asking.
Because of your model?
Well, because we're a company, we're a startup, and we can try things and make decisions faster, and we can pilot. It's just easier. So one of the things that I'm very proud of is how we innovated our clinical model. When we first to the following, patients enter us through two basic first visits. An individual that we triage for some low complexity musculoskeletal issue they'll start with our physical therapists. Our physical therapists are all MSK trained. They have 8 to 10 years of experience. And so those patients can start by being evaluated by the physical therapist and then get escalated to the physician if need be. Patients that have more complex medical issues start with what we call our integrated visit. And this is a thing of beauty. So that 30-minute new patient visit is with the doctor and the physical therapist together with the patient on the same video visit. Like that doesn't happen in the real world.
Yeah.
And so what that means is the patient only has to tell their history, their story once. There's one virtual physical examination. The doctor's rendering the medical diagnosis, the physical therapist the functional diagnosis. Everybody knows the plan. In the real world, doctors and physical therapists don't commonly talk to each other about a patient.
Yeah.
Okay? So, I mean, they could if there's a problem.
Yeah.
You know, I did surgery on a patient and the patient isn't progressing as they should with physical therapy, then I would call or reach out to the therapist, or the therapist could reach out to me. But there's really not a lot of collaboration. Like, is this the best plan to start with for the patient? We eliminate that from the start because we have this integrated visit. And that has been a wonderful experience, not just for our patients, but for our clinicians. So the docs and the physical therapists love this. We did a research survey study on it. We published those results. And the finding that was most near and dear to my heart was that 93% of our patients felt that they understood their condition better and how to start treatment. I'm like, okay, that's really good.
So the communication among your doctors, physical therapists, and nutritionists and all of that is very integrated?
Yes, yes.
How are you able to succeed with that?
Well, in terms of like operationally how we do it,
Yeah.
well, the patients have their care team members. So in your medical record, you have your clinicians that are listed there. And so if you send a message through the patient portal, you can send it to one of your clinicians, you can send it to your whole care team. So all of this can be shared by your care team. So people know, other people on the care team know what's going on. And then, of course, we have other ways that the clinicians can communicate with each other through Slack or, one of our other communication platforms.
Yeah.
So there's a very good level of communication. And we have, as you would expect, what we call clinical grand rounds, where a clinician will bring a patient to the group as a whole. If the clinician is concerned the patient isn't making progress or there's something unusual, and then we can get diverse clinician input and figure out, who does that patient need to see next? Do they need to go see the doctor again? Do they need to see the registered dietitian? Who do they need to see so that we can advance them?
Do you find that communication is pretty seamless and it's well received?
Yes.
Yeah.
Yes. And that's the key. Communication on the team to benefit the patient is the key. And that is something that is more challenging in the traditional system. The clinicians in the traditional system really don't communicate with each other that much.
And if they're not used to it and there's less, like you have the integrated model with having multiple fields together, it probably helps them get used to communicating with each other so that that kind of eases the tension. Because sometimes there is tension between different fields.
Absolutely. And that's another reason why that integrated visit with the doc and physical therapist is so amazing, right?
Yeah.
Because now there's everybody's aligned with the care plan. Yeah.
So among some of those challenges, if you had a magic wand, which one would you dismiss?
I would get rid of any possible tech issue that any patient or clinician ever had. That would be my magic wand.
Yeah.
Okay. I mean, just like the other day, one of our physical therapists lives actually in New Jersey, in your state. And of course, y'all had the blizzard. and her
Yeah.
power's out, and she doesn't have internet, and we got to get a hold of her patients and get her patients rescheduled. But it's not, I mean, some patients have challenges with just the video connection, or I'll call it tech issues, right?
Yeah.
Although the number of individuals that are not comfortable with technology is decreasing rapidly every
Yeah.
year,
Yeah.
right? Because think about it, right? People in their 60s, even people in their 70s are used to email, video, internet, tech. So the concept that seniors and Medicare patients are not going to embrace telemedicine is not true.
Yeah. You're involved in discussions about AI in orthopedics. How do you think AI will change how Vori Health delivers care in the
So
future?
we are working on our AI project now, and I'm actually very excited about it. I think that AI is going to be a very powerful tool to help us with patient engagement and encourage patients. It's not a substitute for clinicians. You have to be very diligent in how you build and design these models to make sure that the appropriate guardrails are in place. I think there's huge potential. We're working on our project on how we're going to be incorporating this into our model right now. But, so I'm excited about it. I'm having fun working on it. Of course, I always follow, the 80-20 rule. Like if we get 80% of it right from the get-go, we are rock stars. And then we adjust the 20%. With AI, the issue is you got to make sure that 20% isn't a critical 20%.
Yeah.
It's
Yeah.
some minor stuff,
It
not
can make
something that's important.
it can make big changes, which means if it's off, it'll be off by a lot.
Yeah, so like in our model that we're building, AI isn't going to diagnose a patient.
Yeah. Yeah.
But AI can help escalate concerns. AI can make it easier for you to do your sensorless motion tracking exercises, your home exercise program. AI can help you understand the calories or nutritional value of the plate of food that you put in front of yourself at night for dinner. There's so much
Yeah.
that AI can do to help individuals be empowered. The goal here is to help the individual be empowered.
Yeah. That's great. In the next few years, what impacts do you hope to have on the healthcare system?
Well, we want to keep growing and taking care of more patients and helping more patients get better and lowering costs.
That's good.
So, it's because if we do a better job taking care of patients and promoting effective non-surgical care, it's the total win. We get more patients better without a risky operation, and we lower healthcare costs. Boom, right?
Was that
That's it.
Yeah. Was that value-based model, that was what you had founded the company on?
Yes.
And do you get very good feedback from insurance companies, I assume, with it? Good results?
We do. We just had one of our self-insured employers just got up at a big national meeting and spoke about how, since partnering with us, their spend on musculoskeletal has gone from their number 2 spend to number 10. That's huge. I mean,
Congratulations.
thank you. Thank you.
Yeah.
Well, part of that is they've been a fabulous group to work with. I've really enjoyed working with them, and they have allowed innovation within the care model. So we now see their members, if somebody says, "Hey, I think you need an MRI for your back pain or your neck pain," those patients come to us and we
Yeah.
evaluate them. And if our docs think they need the MRI, they order the MRI, and it is automatically approved, auto certified by the insurance company. Okay?
Yeah.
But what happens is, for a lot of those members that then become our patients, we say, "Hey, you actually don't need an MRI right now. Let's get you started on physical therapy. Let's try these other things."
Yeah.
Because the research shows that you are likely to improve in the next 4 to 6 weeks. And you don't have any what we call red flags, meaning symptoms that are worrisome for a serious medical condition, which would be clinically appropriate to order an MRI right now. So you don't have red flags. we don't need an MRI right away. Let's get you started on non-surgical care. We'll do the MRI down the road if we need to. So it's that interruption that helps decrease inappropriate advanced imaging that is so key, because once they get the MRI, it's so much more likely that they're going to go down that surgical path, whether they really need surgery or not.
What do you think is the biggest opportunity for growth for Vori Health right now?
I think the biggest opportunity for growth for us is more contracts with self-insured employers and insurance companies that recognize that they need an innovative model such as ours to not only drive clinical outcomes, but control costs. Because we just, you just can't keep spending more and more money and keep pushing these increases down to the patient and family level.
Yeah.
My youngest, who's an elite level athlete, has to go out and get insurance. Okay. So I'm researching all this stuff for her. It's nuts, John. It's nuts what her monthly premiums are for this perfectly, not just healthy, like she's like super healthy.
Yeah.
Okay. It's crazy. I don't,
Yeah.
It's crazy. And that impacts families and affordability. And so we need to find the solutions such as ours that are going to help lower the cost of healthcare to make healthcare more affordable for individuals and for companies, right? If we want to talk about economic power and how we want to help the country be economically strong, then we need to be addressing healthcare costs for these companies.
Yeah. What does a day look like for you? A regular day?
Well, I get up and I'm a tea drinker, so I have a cup of tea, and I'm drinking my first cup of tea. I go through emails or my Slack messages, and that's usually about 30 minutes or so. And then I exercise almost religiously every day for 50 minutes to an hour. And then I'll shower and I'll get dressed, and then I start on calls. Then I just start with the rest of my day and have sometimes, just a back-to-back day with calls.
Yeah.
And then have dinner, and then I go.
Yeah.
Then I get in my spot,
you.
in my comfy spot at night after dinner, and open my laptop and do some more work.
Is it some of that communication? Are the calls like based on some of those communication things, issues, technology issues between the?
Oh, there are all kinds of calls. Sometimes they're calls with potential clients. They're interested in us. They want to learn about our model.
Yeah.
Existing partners, we'll have quarterly business review calls with them. It's recruiting, we're recruiting for additional doctors or physical therapists, whoever the clinician type is. It's just staffing, making sure that we have good staffing so that we can meet our goal of a patient being able to get an appointment with us within a few days. That is another value of our model is, when you're hurting and you need help, you need it. You don't want to wait 4 to 6 weeks to get the appointment with the doctor. You want to get in and get help right away.
Yeah. And all of your sources are not just local. They can...
Yeah, we are nationwide. So we treat patients across all 50 states and the District of Columbia.
And my last question is, do you have a success story with anything in particular?
We have lots of success stories with our patients, which are the stories that are most meaningful.
Yeah.
We just created three great patient videos. They'll be on our website soon. So that I get the most satisfaction out of those stories.
Yeah.
Because that's what healthcare should always be about, right? It should always be about how we're helping individuals and their families have better health, improve their quality of life. Those are the meaningful stories. Now, at the same time, we got to run the business, because my favorite Mayo Clinic quote I'll share with you, John. So Sister Generose, who was the last nun to run St. Mary's Hospital, which is the bigger hospital of the two hospitals at Mayo Clinic, Rochester, Minnesota. So Sister Generose is famously quoted for saying, no margin, no mission. Meaning, if you don't generate a financial margin, you don't make money, you can't sustain your mission of helping people, right? So making money in healthcare is not bad. It's not evil. It is required. You have to make money to keep the doors open. But people don't always include the second part of her quote, which is no mission, no need for margin. Okay? So if you don't have a mission to serve the people in your community, then you don't need to make a margin, and you shouldn't be in healthcare. And that is, and that's the fundamental difference between the business of healthcare and other businesses. Okay? Yes, we have to make money, just like every company has to make money. But we need to make money because we are serving our mission of helping patients. And if we don't do that, we have no right to be in healthcare.
Yeah. Nice. Where can listeners learn more about you or your company?
VoriHealth.com. Go to the website. They can follow me on LinkedIn, and especially if there's any self-insured employers or insurance people out there listening, reach out. We can help you.
Well, Mary, this has been a fantastic conversation. It's inspiring to see Vori Health, how it's changing the musculoskeletal care and focusing on fairness and delivering better care.
Yeah.
Your commitment to transforming healthcare and emphasizing holistic solutions is exactly what it needs, really. So thank you for sharing that today.
You're welcome. All right, John.
And to our listeners, thank you for tuning in. We hoped that you found valuable insights in the future of musculoskeletal care. So join us next time for more.
Absolutely. Thanks, John, and thanks to your listeners.